Good afternoon, and welcome to Keys to Creating and Sustaining a Robust PMO, a complimentary webinar from healthsystemcio.com. My name is Anthony Guerra. I'm the editor-in-chief of healthsystemcio.com, and I'll be your moderator today. We will be taking questions. We encourage you to ask questions. You can go ahead and type them in at any time into the lower right-hand corner of your screen in the Q&A box. Leave the default set to all panelists and send them in. We'll be looking at those and posing them later in the program. You can download the deck. You see the URL in front of you. It's at the bottom, shortened versions at the bottom of all the slides, and I'll also send that out in the chat box shortly, so plenty of chances. And we are recording this event, and we will have an archive available within 2 business days. You'll get an email when it's ready, and a separate registration is required. Just so you're going to see how we're going to spend our time today, we're going to go about 40 minutes or so. First, we're going to hear from our speaker, Chuck Podesta, CIO at UC Irvine Health, and then we're going to have our Q&A. So without further delay, I'm going to turn it over to our good friend, Chuck Podesta. Chuck, thanks for joining us as always.
Thank you, Anthony, and thanks everyone for taking time out of your day. Hopefully you will find this valuable. So what I'm going to talk about is how to really get started on a PMO, and sometimes that's the hardest part, is what are the first steps that you need to take to get going on it, if your organization does not have one. But also want to talk about, if you do have one, what are some of the key success factors to, keep it moving. Because there is it's one thing to get it going, it's another to keep it going, and some of the stats out there are pretty pretty enlightening from the standpoint of how hard it is to keep a PMO running. You might think after the first year you've got it nailed down, and then 2 years later you find that it's not as valuable as the organization doesn't feel as valuable as you thought it was, or as it was in the first year. So we're going to talk a little bit about that as well. So moving on, there's really 3 types of PMOs, and it's important that when you are starting a PMO, you pick the right one for the organization. And there's the first one is what I call an enterprise-wide PMO, and that's a PMO that would be for the entire organization. So it wouldn't just be for the IT function, it would be for, facilities and, other parts of the organization, more from a strategic perspective, really using the same type of program that you would use for an IT PMO, but much broader and much more significant to the organization, and also much more difficult to implement, as you can imagine, since it is enterprise-wide and the buy-in that you would have to get. Then there's the IT only, and I have that in blue because that's what we're going to talk about today. I'm going to focus on that because that's the most prevalent in the healthcare industry. And then there's you could have a PMO around a single large initiative, and I use the example of an EHR implementation, something that's a year and a half, 2 years, 3 years. You would have the PMO in place just for that kind of one initiative, with all the different projects that would be under that program. Just a quote, and you see on the bottom there from Gartner just last year, was 50% of the PMOs fail within the first year, and we're going to talk about why that happens. I just saw a stat the other day that said 2/3 fail after 3 years. So even though you make it past the first year, that doesn't guarantee that you will be successful going forward, because, as I said before, after 3 years, you can there's still a very high failure rate. So it's something that you really have to focus on and continually improve going forward. So I'm going to just go right into the reasons why they fail, because I think that's probably the most important discussion that we can have, is really understanding these things and then making sure that you avoid them as you either create your PMO, or maybe you're struggling with it today, and you might see some things here that ring a bell. So the first one is really the too rigid aspect of it, and it's really becoming that PMO police, where everything has to go through the PMO in a very structured, processed way, and there's no one-offs associated with it. You're also putting small projects through there. If the infrastructure group is doing something with a network or, adding servers to your VMware farm or things like that, you want them to go through the PMO. And when you do things like that, you can really, grind the organization to a halt if everything is going through the PMO. So you need to be really thoughtful around, you definitely want to have process, compliance, standardization, but you really need to be thoughtful as to what projects actually go through the PMO, and it's not seen in the IT organization or the organization at large, as the IT or the police around all projects. The organization begins with that enterprise PMO model, and that never works. It's an evolution. You can always start with an IT PMO and then evolve into an enterprise PMO once people see the value, the organization sees the value of the IT PMO. They can transition. I've seen that, but I've never seen an enterprise PMO model get out of the gate and survive. That would be very, very difficult to do. Number 3 goes without saying, the executive stakeholder commitment, both and not just from outside of IT, but within IT. The management, the leadership within IT needs to be on board. It can't just be, the director of applications, so to speak, says, we need a PMO, and the CIO says, yeah, have fun with that, and off the director goes without any, senior leadership or leadership support within IT. That's a recipe for failure, and I've seen that as well, where even CIOs aren't on board with PMOs. Here at UC Irvine, I'm actually standing up a PMO right now. When I got here, it was all the project managers are distributed amongst the various applications and are implementing projects, based on their backgrounds. And we are, I'm a big proponent of PMOs, and we're pulling that together now. So even here in 2015, an organization as large as UC Irvine does not, have a functioning PMO. So that's important. The other piece of that is definitely from a COO, a C-suite, CFO perspective. You need that executive stakeholder commitment as well, because it's going to cost money. Here at UC Irvine, it's we have to buy a tool. I need to hire a manager. We're pulling all the PMs together, so there's HR implications. So I really need my executive team on board with what I'm trying to do here. So that's important as well. What I call cookie cutter PMO leadership, and really is when you're, and I'll use the UCI example again, is when we hire that manager or the director of the PMO, and we'll certainly be looking for somebody who has that experience, but I don't want somebody who just is going to come in here and say, this is the way you create the PMO and run the PMO, based on their past experience at another organization. Every organization is different, and what I've seen is successful PMO leaders are ones that can adapt to the culture, the new culture of the organization, the way things are done in the organization, and not just to take a cookie cutter approach based on their past experience. That tends to not work. The accountability, authority, and responsibility not clear, and really what I've seen is with PMOs and the leadership of PMOs is they're accountable and they're responsible, but they don't have the authority, and that's the key. Is directors of the PMOs, I've always endowed them with unalienable rights to get things done in the organization, and make sure my other leaders understand that when that director of the PMO contacts them for some reason, that they need to respond, and that I view that leadership position as a very important leadership position within the IT, so that they have the authority to get things done. That's critical, especially when you get to things like time management, when your entire staff are entering time into the system and wondering why they need to do that, and they look at it as a burden. The leader of the PMO needs to have the authority to keep pushing that through and get that done. PMOs that are too tactical, not strategic, where the projects they should be working on are projects that have strategic value to the organization, especially when you first get started. You want to make sure you get the first half a dozen projects that are in there are very strategic in nature to the organization, so that what you want to see is your customer base sees the value right out of the gate of your PMO, and can see, oh, things, 3, 4, 5, 6 months later, they can see that things are different, that projects are being managed, that they're on time, on budget, that there's results associated with those, and that's key to building credibility around the PMO. Poor PMs, again, goes without saying. A lot of people are thrown into the project management role without training. You want your PMs to be certified. I'm a big proponent of that, and trained as well as you can, and they need to have continuous training. They need to be customer-facing people, because that's what they do. So it's very much very important to have really high-quality PMs in your PMO. Not using metrics or resistance by staff to time report, and that's big. Typically, that's something you tackle a little bit later, but it's really important that you can show not only within IS the value of the PMO, but also outside of IS the value of the PMO, and you can't do that without metrics. So the staff really need to put their time against projects, against maintenance, against support, so you have a total picture of IS and what you're working on. That helps with the capacity planning aspect of how much you can actually do. It also helps in budget season when you're trying to get more FTEs. Based on past experience, you have some data that you can show the C-suite as to why you would need those FTEs based on the number of projects that are coming in the following years. Without that metrics, it's hard to have that conversation. So the staff really need to understand that, even though it's hard to put in that information, and you can make it easy, you do it once a week, that sort of thing, with the right tool set, that it's a value to them, because it's going to allow them not to feel as overworked as they always do, because you're going to use that data to manage the number of projects that you can actually complete in a year. And the last one's really important, going big bang with the implementation, picking the tool and then basically turning all the features on right away, including the time reporting piece of that. That's very difficult to do. PMOs are really an evolution and take time to implement, and it's really important not to set a date and say our PMO is live as of this date. And we'll talk a little bit more about kind of how you should transition. Okay. So just on the maturity model, and this gets to that last point of the big bang, is first you've got to look at where you are in your organization, whether you already have a PMO or you don't have a PMO. If you don't have a PMO, you're probably in the level 1 maturity aspect, where it's you're organized into project cost tracked at the project level. You really want to move with a PMO. You want to get up to over the first year, I would say you want to get up to level 3, and that's why I have the arrow there. But you've got that metrics defined, value model constructed, benefits quantified, you're ranking projects, things like that. So you really want to move through this maturity model. But again, you can see the bullet down below. Most PMOs fail to get past level 3, and that's where the after a 3-year period, you need to be in the level 4 and moving to the level 5. Otherwise, if you're stuck in level 3, the chances are after 2 or 3 years, you will struggle to keep the PMO moving, because it will start to look a little bit stale. And if you look at level 4 and C and level 5, you're getting into application portfolio management at that point, and that's what's, from a strategic perspective, is huge value for an organization. They will really see the value when you hit level 4 and level 5. Not to say that level 3 isn't important, that's extremely important, but you can't stop there. You need to move beyond that. So depending on where your PMO is on this level, you can look at, if you're at level 2, you need to go to 3. If you're at 3, you need to go to 4, and on and on. So just the PMO components, it's just not project management, and that's the other important point of a PMO. Some PMOs are called program management offices, not project management offices. and that's great because to me a program encompasses all the things on the left side. First off, you got to start with the portfolio management side. You're doing this from a strategic perspective, and you're managing your application portfolio just like you would manage, your 401k or your 403b and your retirement funds and moving those around. And you want to make sure your portfolio management, your application portfolio, is not antiquated, not obsolete. If you have old systems, you want to make sure you have plans in place to upgrade those or replace those, and that's really needs to be at that portfolio planning, because that's going to drive a lot of your projects. If you're replacing old systems and upgrading old systems, those are all projects, but they're all very strategic and very customer facing and have huge value to the organization. So you need to come at this from a portfolio management and make sure when you start looking at tools, you're looking at portfolio management tools, not project management tools. Most application portfolio management systems have project management tools embedded in them, so you want to focus on the portfolio side. And of course, project management, that goes without saying, the initiate, plan, execute, close. Resource management, we talked about the time tracking, and I'll give you a little story at the end, how I used it actually in Vermont to really change the conversation around what IT could do and, more importantly, what they couldn't do. And then financial management, you need to tie in if you're doing capital projects, you want to make sure you're tracking the budgets associated with those and not have that separate from the project itself. That needs to be all integrated in. And of course, you'd see on the right side, the benefits realization piece is big. You want to define that up front and track it along the way, and then as you close out the projects, make sure you're tracking the results and to what you expected, and that's extremely important. And this feeds all into your IT governance, and your IT governance is going to be really interested in the benefits realization, of the various projects. So a lot of times the IT governance has approved many of these projects based on that benefits realization. So the PMO needs to report back as to whether they were successful or not. Getting to, we talked about why they fail, but let's talk about what successful PMOs do and will do. So they will centralize and manage the application portfolio strategy. That's extremely important. Saw that based on the previous slide. Implement an unbiased prioritization scoring mechanism, and that's critical to a PMO. You need to make sure that your customers understand how you're prioritizing the projects, and that they agree with that prioritization, because as you know, there's a give and take. You can't do everything, and you want to do the highest, the projects that have the highest impact to the organization. So the scoring mechanism needs to reflect that, and especially when you're bringing some of these larger projects to the IT governance to get approved, the scoring mechanism needs to reflect the importance of that. So you need to spend a lot of time on that. And then also defining, what is a project and what is a small project, medium project, large project. I wouldn't get too crazy over that. I've seen people spend 3, 4, 5 months, organizations trying to define what that is, greater than 40 hours of work, greater than 80 hours. Don't go crazy over that. You can adjust it over time. The way I've always done it is a large project is greater than 500 hours, and everything below that is a small project, and just leave it at that. And it's really the large projects that you're trying to manage, because those typically have the higher impact to the organization and also, take the most of your resources. So if you can capacity plan around the large projects, the smaller ones tend to take care of themselves. Coordinated oversight of all IT projects. That's key. That gets to the authority, accountability, responsibility aspect. Facilitate the prioritization of all IT projects, kind of tied to number 2. Ensure PMs are trained and certified. That's, to me, is key. It's not that expensive to do. It's also, I view, project management and project managers as a career and as a professional position, so they should have that certification. You create and maintain all the policies and standards related to the PMO governance. That's key. The charter, how projects are initiated, how they flow through the process, all needs to be documented, and the policies associated with that need to be updated and managed by the PMO. You definitely want to create successful, repeatable processes, and that happens over time. And again, that's why, a big bang approach isn't going to work. You're learning as you go with these PMOs. As you start to do projects that look like other projects that you completed successfully, maybe the year before or 6 months before, you can start to create those repeatable processes by utilizing templates based on a new project looking like an old project, that sort of thing. So all that takes time, and the organization needs to understand that it takes time. You're going to manage the IT resource allocation to all projects. That's key to success, making sure all the managers know, all the leaders in IS know what their resources are doing on these projects, how much they're allocated to the various projects, and that they're part of the success of the PMO by making sure that the resources are doing what they need to do on those various projects. Managing the project budgets, key. I think a lot of times that's left off. It's managing the projects, and then other people manage the budgets. I think it's all, your project managers need to manage both. They need to have that skill, and I think that's important. And then track and communicate benefits. Sometimes that's lost. You finish the project and you move on. You really don't want to do that. You want to take time to celebrate, communicate those benefits that were achieved by completing that project as part of the closeout. Reporting that back to the IT governance and to the executive sponsors, of those various projects going forward. So, implementing, if you don't have a PMO, so there's really a couple of sections here that you need to focus on. The first one's assessment and initiation, and this is at your year one. And what you want to do is, if you go back to that PMO maturity model, within the first year, you're trying to get from that level 1 to level 3. And the way to do that is you have to go through that maturity model assessment. So look at your organization, see where you are. Are you at a level 1? Maybe you're at a level 2 even without a PMO. You're probably not further than that. So you want to see where you are current state. And then the next step you want to take is, and this is actually what we're doing at UCI now, is a current project assessment. Really gathering from all the PMs and all the leaders across the IT organization. What are all the projects? Maybe they're all in SharePoint. Pulling them all together and really then identifying what are the high-value projects. Which ones are we going to move into a centralized PMO? As we set that up. So you do that. Then you've got to work on your charter, your strategy, your mission statement. What is the PMO going to do for the organization? What's it all about? Why does it exist? All those things need to be put together into a charter. And then what's the governance process? How are you going to score projects? That whole project initiation process. How do the users or customers contact you and get a project started? All that needs to be evaluated and worked into the process. And then the business case, once you do that evaluation, see where you are, then you develop the business case, which is really getting the executive buy-in, and not just executive buy-in, outside of IS, but within IS as well. Hopefully your CIO is leading this charge, but I've seen some organizations where they're not, and so you may need to convince the CIO, but definitely outside the organization. You want to be able to go to the C-suite because there will be dollars involved in getting this PMO off the ground. And that comes to the next set of tasks, which is planning and execution. Once you have created the plan for the PMO, and this is where the dollars come in, is you're going to have to conduct those planning workshops. This is really creating the implementation plan of the PMO. And getting everybody on board, what does that first year look like? So not only are you setting up the PMO to be able to manage projects, you're actually setting up a project to create the PMO. So it's kind of your first project right out of the gate is a PMO creation. So that's important. You need a tool at this point. And as part of the initiation aspect, you probably are searching for a tool, but once you get to planning execution, you need to have purchased a tool and have that implemented. We did that in December here, and we're using that tool to help stand the PMO up, because the tool kind of walks you through all the components that you need for a successful PMO. So you can use that tool to help drive your PMO creation. But you can't survive. You can't use spreadsheets and SharePoint and things like that. You really need a strong application portfolio management tool, and there's quite a few out there that you can look on Class and other Gartner and some other organizations can help you decide on what tool is best for your organization. But without it, you can't succeed. The PMO manual, which is really the operating model, the charter, you can see it includes governance, the intake, user training, prioritization scoring. All that is going to be part of that PMO manual. It's something that you'll be able to, could be in PowerPoint, that sort of thing, where you're going to be educating the users as to how this PMO is going to operate. You'll also be educating your internal IT staff as well. Centralizing the PMs under the PMO manager. We're actually doing this right now, so you've got to work with HR to get that structure in place. Centralize those high-value projects that I talked about. You identified them in the earlier phases. Now you want to centralize those under the PMO, and again, getting them loaded into the application portfolio management tool, starting to use the tool itself to manage those high-value projects. So you want to hit those right out of the gate. You want some quick wins so the organization can see the value. Next up would be, and this would be, I wouldn't do this for probably 3 to 6 months, but the time reporting aspect of it, because again, you need to educate your staff as to why they need to do that. There's training involved. Once you have that in place, then you can do the capacity planning model, and that's resource forecasting. That's going to be real important. You're looking at projects down the road. You're looking at your current FTE situation and trying to forecast out 3 to 6 months as to how many projects you can actually take on in a given period of time. Then the last piece is really the self-service piece. Getting your customers involved from a benefits tracking, project tracking, where they can see dashboards. They can be involved. The executive sponsors can see where their projects are at any given time. You want to give them that transparency view into the PMO. You don't want to do that too early, because you're going to be having a lot of missteps along the way and fine-tuning. So that's probably going to be a year out. Maybe in year 2, you're going to do the self-service reporting once you're comfortable with the APM tool and having everything in place there. So what does success look like? To me, it's when you get to year 2 and into year 3, you're driving more projects to completion without increasing resources. So the organization can see that and you can see that you're getting more done with the same amount of resources. And you will. With a successful PMO, you absolutely will, just by having the structures in place and the processes. Projects completed in drastically shorter time frames. You'll see this as well because of the coordination. Using the APM tool helps that as well. The impact is clearly felt at all levels of the organization. You should be getting kudos from your customers, from the executive sponsors. They shouldn't see that things are different, 6 to 8 months into this process. Once you start doing some of these projects, the executives understand the value because you're going to be in front of them, talking to them about the value and the ROI associated with these projects. They should see that. The IT staff have accepted the time reporting. You're not pulling teeth every Friday to get their time in. They understand that the importance of it and know that it's going to help them in the long run, either getting more resources or managing the resources that we have. So they need, once they understand that value, that's a huge benefit. You begin implementing level 4 project rich tools, and so you've gone beyond the level 3. You've been successful at level 3. Now you're moving to level 4. You probably have a sustainable PMO at that point. If you're now looking at putting risk associated with projects and using risk tools associated with those projects, any organization understands that. And again, we can spend a lot of time on, that's probably another webinar on level 4 and level 5 getting to that level. It's hard to do, but the value is tremendous. And then the organization understands the IT capacity, and I'll just give you a quick story. What I mean by that is when I was in Vermont, we, just like everybody else, with electronic health records, you've got a backlog of 80 or 100, or it could be higher than that, of enhancements that people want. And so through our PMO, we had about 80 greater than 500 hours projects. So if you remember what I said earlier, large projects. So we had 80 of them, and of course, since people requested them, they are assuming that you are going to do them. But we, had our time reporting in place. We started to look at our capacity of our electronic health record team, and we were able to see that we were spending about 60% of our time on maintenance and support of the electronic health record. So that only gave us, 40% of the resources to do enhancements and new requests. So based on that, we, were able to look at the 80 projects and realized over the next year, based on the resources that we had, we could do 8 of those 80. So you can imagine that was kind of eye-opening. So there's no way you're going to get enough resources to do all 80. That's not going to happen. So what we did was pull a multidisciplinary group together and really had to educate them as to why we could only do 8, and we used the metrics to do that. And it's pretty clear that, based on the resources that we had, we could only do 8 greater than 500-hour projects. So we, internally to IT, we were able to whittle down the 80 to about 40, and then the multidisciplinary group took it from 40 to the 8. And then what we did was we committed as an IT organization, we were going to do these 8 major projects over the next year. And but we also put rules in place that said we know there's going to be the 9th one and the 10th one that's going to come up. And the rules are that if on the 9th one, that has to replace one of the 8, or we have to go out and outsource it and get, consulting resources in to do the 9th one. And so people bought off on that. I actually took it to the senior leadership team. They actually were appreciative of it, knowing that, I think it was a CFO said, what's really nice about this is not only do we know what IT can do, we also know what they can't do based on the resources that they have. So it was pretty clear using the APM tool. So they bought off on that. And within 2 weeks, of course, the 9th one came up, and it was something from the chief medical officer. And of course, it was patient safety related. I think it had to do with lab routing. And, patients were, going to be harmed in some way if we didn't clean up the lab routing and all this kind of stuff. And so we took a look at it, and it was about 1,000 hours of work. So it was definitely in the greater than 500 hours. We, sat down with the chief medical officer and said, okay, here's the 8 that we have. Which one would you like to replace? And he looked at the 8 and he goes, none. Those are all really important. So then we, costed out by bringing, it was $400,000 or $500,000 to actually do it, using outside resources, consulting resources. So we showed him that, and he looked at that and he said, well, you know what, we'll do it next year. And so the whole tenor of the conversation changed. It wasn't about projects going into a black hole in IT. It changed the whole tenor of the conversation that we had with the C-suite, and particularly in this particular case, the CMO. And it really opens a window into IS that the customers and the users have never been able to see before and really understand what you're doing in IT. So again, hopefully you see the value of a PMO just based on that one story. So I think that's it for me.
All right. Excellent, Chuck. Thank you so much for that great presentation. Well, we have time for questions. As I mentioned, go ahead and type them in the Q&A box, the lower right-hand corner of your screen, and leave the default set to all panelists. First question from the audience. Within the PMO components, where would programs fit in this model? Does that question make sense to you?
Yeah, sure. Programs and projects can intermingle in a PMO. So you could have an EHR implementation going, which in my mind would be more of a program than a project, because of all because of how large it is, and then you'd have all the projects of the EHR implementation underneath that particular program. So you can stratify them, and the APM tool can really help you do that, because you can set things up as a program or as individual projects within the APM tool. So it's yeah, they can intermingle easily.
Very good. What metrics are the PMS held accountable for?
Well, it's really when you set up a project, for example, you have a timeline, you have the resources, and you have the scope, and within the resources would be the cost as well. So did you manage to the timeline, to the scope, and to the resources? And how successful were you on hitting the what you defined at the beginning of the project? How successful were you on hitting the budget, on hitting the timeline of that particular project? And with a PMO, you should be hitting that 80, 90% of the time. And if you are missing it, you're not missing it by much, and you're using the PMO to manage that. To me, that's critical success factor, because people now are seeing when you say that you're going to do something in 3 or 4 or 5 months, you're actually getting it done, and you're getting it done within budget. So that's one of the metrics. The other is what the PMO will help you do at the beginning, and depending on how you do the intake of a project, when you're doing the scoring, the ROI aspect of it is really important. So the benefits need to be defined up front before that project is approved. And so once you get to the end and you close out the project, were you able to achieve those benefits? So that would be another metric that you'd want to track and communicate to the rest of the organization as well.
Very good. Do you have a PM to project ratio?
Boy, that's a good one. I've never really looked at it that way. In Vermont, to do we had 10 PMs in the PMO, which quite frankly wasn't enough. And that was to do the 8 that I mentioned, the 8 high-value projects. Because you're going to have a PM on each one of those, so that's 8 PMs, and then the other 2 we're working on all the other projects that were going on in the organization, because you're doing a lot of smaller projects as well. So we had 10. I don't know what the ratio was at any given time. It's probably, I would say, 1 to 3, somewhere in that neighborhood, was pretty workable. But what we were finding is, as the value of the PMO was seen by the organization, people were asking for our PMs to start working on projects that were not IT related. For example, the marketing department was doing some work, and they needed a project manager to help. So normally they would go outside to get that, but they actually contacted our PMO, and we let them have one of the PMs for a few months to do non-IT work. So when you start seeing that, if you remember when I talked about the enterprise PMO, you can start to see the organization start to think about, geez, the value of this may be better and maybe even greater outside of IT. So organically, you want to kind of let that happen. And before I left Vermont, that was starting to happen.
Chuck, just can you give a little size on Fletcher Allen? Some people are asking. You referenced it a number of times.
The size of Fletcher Allen?
Yeah.
Yeah, it's an academic medical center, 500 beds, about 46 practices, 500 physicians on the clinic side. It's also part of they actually changed now the University of Vermont Medical Center, part of the University of Vermont Health Network. I was at the system level, which was a 4-hospital system as well. So the PMO not only was managing what was happening within Fletcher Allen, we were also expanding out to the system level as well.
How big is UC Irvine?
UC Irvine's about 450 beds, very similar to Fletcher Allen, except that we're not a system. We're an academic medical center as well, about 500 physicians in the clinics here. But the difference here is that I'm responsible for research and the medical school as well. So all of those research projects and medical school components are part of the PMO that I'm standing up here. So from an IT perspective, it's actually a little bit larger.
For folks, I'm sure we got a number of CIOs on the line, maybe some folks that want to get to the CIO position. What degree of familiarity or competence do you feel that CIOs should have today? Is there a type of training that you could describe? If you're a CIO, what should you go out and get? Or if you want to be a CIO, what kind of training around project PMOs should you have?
Well, I think, if you've never stood up a PMO before, yeah, I think, there's tons of seminars out there as to how to do it. A lot of the application portfolio management tool vendors have those. You can go on their websites and you can see they're doing webinars as to how to stand them up, similar to this one, and they get into, much more detail than I could in 45 minutes. They've also have seminars where you can, fly out there and spend a couple of days as to how to do that. So, yeah, I would urge that. I don't think you need to go through, PMP certification or anything like that, because you want to stay strategic and keep it at a high level. But to see the value of a PMO, I would definitely talk to those vendors. I would also ask them, who are your best users of the tools? Who do you think is at level 4 or level 5? And then go visit those organizations and see what they're doing. I think that would open a lot of eyes, because it's hard to see the value of these PMOs because they are costly, they're hard to set up, it's hard to get the C-suite to approve, and it's one of those things, once you have it in place, you look back and say, boy, how did we survive without this? And the organization says that. And so you definitely want to go visit other organizations that have done it so that you can bring back that information to help sell within your organization.
I think we have time for about one more question. You mentioned about when you're standing up a PMO at a new place, essentially you're going around and collecting projects that are ongoing or in the pipeline in little niches of the organization, this person, that person, this division, that division. Nobody likes to have budget, authority, power sort of taken away from them. Talk about that dynamic and some ways you can go about standing up a PMO and getting those things and acquiring those projects, as it were, without making a whole lot of enemies.
Yeah, so the way I had to go through that process here, and as a CIO, and I'm going to come at it from a CIO perspective, what I did here within the first couple of months of being here was to kind of put my consulting hat on and look at my entire organization and see, what was working well, but then what were some of the opportunities to improve. And one of those was that, we did not have a PMO. So I did a state of the state kind of presentation to my executive leadership team. And one of those things I focused on was that a lack of a PMO. And similar to this webinar, I walked them through, the benefits, what I've done in the past, what I've seen in the past of doing this, and then also, the guidelines around how a successful PMO would get launched, and what are some of the rules that we need to have in place. And those are, gathering all those projects together, hiring a director or a manager of the PMO, all these things need to be in place. And then I also was able to outline, we're going to run into these issues with these areas because they're managing their projects in their little fiefdoms and their budgets. And this, once you get the CFO on board, all that goes away, because a lot of those are coming from the finance side. That's what I've seen in most organizations. They tend to hold tight to their projects. If you can get the buy-in from the CFO, you can, that individual, you can go to their finance meetings and talk to them about what you're doing, getting their buy-in. And it's really about communication and not just, again, being the PMO police where you're going to take these things and rip them out of their organization. It's more about convincing them as to why it benefits them for you to do it. And it takes a little bit of time, but, in the long run, you'll be much more successful.
Awesome. Well, I want to thank you, Chuck, as usual, for doing these with us. We really appreciate your participation and sharing some of your lessons learned and experiences over the years. As I mentioned to our audience, you'll receive an email when our archive is ready, and a separate registration is required. Those attending who hold the CHIME CIO certification, let CHIME know you attended. Attending any of our webinars gets you 1 CEU. If you've asked us to let CHIME know about that, about your attendance today, we will. Questions, comments, email me, and you can go to our website to see our past lineup, our archives, and our upcoming lineup. So, again, I want to thank Chuck for his time. I want to thank our audience, and everybody have a wonderful day.